Much appreciated. You know, there's a disturbing trend in cancer. More younger people are being diagnosed. That's certainly happening in breast cancer. Travel nurse and survivor Taylor is open about her experience being diagnosed at age 25. Take a look.
I'm Taylor. I'm 27. I am a year and a half breast cancer survivor. I was 25 when I was diagnosed.
I can't imagine, I was 31, but finding out you're in your 20s.
But I think like in your 20s and having had a mastectomy, learning to like look at your body in the mirror and you can feel and what you can't feel and realizing like, oh, I can't feel a whole part of my breast. And then you tack on medications. So with the low to no estrogen in your body, like your libido is naturally being inhibited. You're trying to figure out yourself and what works for you intimately while you also maybe have a partner doing that. I'm a travel nurse, so when I got diagnosed, I ultimately decided I needed to move home for treatment. And so at 26, I moved back in with my parents and kind of felt like a child again, giving up all the independence, especially when you physically need the help from them. And it makes you emotional no matter how much time goes past, but you know, and you think, I'm 26, and if I want to connect with my mom, how do I tell her, like, you need to spend more time thinking about the possibility of your child dying, you know? That is a pain I would never wish on somebody. I remember a few weeks ago, I started meeting with a new therapist and she asked, like, do you think it's made you a better nurse? And like, without hesitation, I could say, yes. The people at your appointments who make a difference, you know, the nurse who's there who tells you, like, I had breast cancer too, or, you know, I remember when I went for my mastectomy and the anesthesiologist was maybe 40 and a breast cancer survivor, and just to hear her share that before going in for a mastectomy at 25, it changed the course of the day for me, and it's something I remember now. And so when I think back on some of the situations I used to sit in and the lack of care or attention I paid to the person who's laying on the table, it's something I think I'm pretty ashamed of. But when I think about the life experience that this has all given me, I know what it feels like to want any sort of relatability or to just have your hand held when somebody's doing a procedure. I think is like a different sense of identity I think I carry with myself at work now. To a young woman, if diagnosed, I think I would just say, like, the fighting is a lot easier than the surviving, in my opinion. What comes after, when there's no more plan, when there's less frequent doctor's visits, when there's less support from the people around you, and set yourself up for success. Learn to be vulnerable, learn to tell people when you're really not doing as great as it might seem on the outside, and learn to just be authentically you.
You know, we have some really wonderful viewers that are joining us, and Dr. Morell, I'd like to share a question we just received from Anissa. She asks, if someone got diagnosed with stage 2 and had her auxiliary lymph nodes removed, is there a chance of reoccurrence?
So she has already done the treatment, and she's now thinking about, well, okay, what did this do for me? When I sit with newly diagnosed breast cancer patients, we know that they're going to meet with, and they do in one setting, a surgeon, a radiation doctor, medical oncology, genetics. That's because we're trying to accomplish one thing, which is the best possible outcome. And how I would describe that to them is, we need to get that cancer out, we need to make sure it doesn't return where it started, and we need to make sure it never comes back and doesn't spread anywhere else. And if all those things happen, it's out, it doesn't come back, it doesn't spread, you're cured. The dilemma, the emotional dilemma especially, is once I've taken all my steps, how do I feel, when do I get to feel free? When do I get to be done? When do I get to say, oh, this is it now, it can't ever come back? And unfortunately in life, nothing is quite like that. But we know that that number is very low, especially when you look at it on an annual kind of basis. And so if you think more, this is 99% likely not to happen this year, and this is 99% likely not to happen this year. And once you get for those 3 to 5 years, that's also quite true. So even though that we're not perfectly ever going to give you a complete off clear, there's so many things that could happen. The focus should be on what's my odds now that I've done everything I needed to do. And that's how I would look at it. That I can't tell you it can't ever happen again, but a lot of things could happen. And the fact is the odds are overwhelmingly favorable that it's not going to come back.
Well, that's good news. Dr. Kadar, we have another question, and this one's from Khan. My sister-in-law has stage 3, and Khan would like to know, what are the survival rates?
Well, it's very difficult to give an answer like this without knowing the details. But I will tell you that we have very, very good treatment and very good advancement in treatment in the past year. And we see that a lot more patients are curable and operable, actually. For example, patients that a few years back would not be even considered for operation today are managed to reduce their tumor and shrink it, and we can operate them today. So it's very difficult for me to say an exact number, but she should, if she'll follow up with all the treatment plan, I'm sure she has a good chance.
Dr. Kadar, thank you so much. We know that you have to run. We thank you for all that you're doing in this area of breast cancer. Thank you for joining our panel today.
Thank you very much.